Hello everybody, welcome to this month's presentation. I decided I'm going to talk about tennis elbow because we're seeing it a lot lately in our clinic. It's a very common condition and it affects a lot of people's lives, more than one would think. So what we've got today, we've got Mitchell, one of the other physios here, and he's going to be my dummy. And I'm just going to go through some of the assessment techniques I might use for tennis elbow and then some of the treatment techniques as well. Okay, so let's go have a look. First thing that's going to tell us it's tennis elbow is the location of the pain. Most people will report pain either near the outside edge of the elbow or right on the bone. The closer it is to the bone, the more likely the problem is going to take a bit longer to get better. So I would much rather it be around here, but if it gets here we can still fix it, but it just might take a little bit longer. So first thing, patient's going to tell us there's pain on the outside edge of the elbow or in the muscle. And then we're going to do some tests. One of the most predictive tests for tennis elbow is pain on extension of the third finger against resistance. So I'm going to get Mitchell to do that and ask him, is there any pain there? Obviously he's not symptomatic, but if he was going to feel pain, it would be around here. Then I would do a test of the second and fourth fingers and get him to resist. Push, push, push. And then again, we want to see if that's more painful than the third finger or less painful. Finally, I'm going to get a grip strength. We're going to measure his good side and then measure the painful side, and we're going to see if there's a difference in strength. Okay, and he's incredibly strong. He scored 80. The average I see is about 20 to 30, and then people with the serious problem, they usually get 0, maybe 2, maybe 3, compared to the other side, which is usually 20 to 30. Also, I'll test extension of the wrist, so push up, Mitchell, and we usually report pain in there. Tennis elbow can also be contributed from the neck as well, so we'd also do a neck assessment, range of motion, pressing, and we'll see if any of that is reproducing any of the pain here. Also, we'll ask the patient what they do for a living and what sort of activities that might have contributed. Usually it's office work, clicking on the mouse, typing, mums with babies, carrying them, breastfeeding, etc., or gym injuries from gripping too much, or even tennis or golf. So tennis elbow isn't actually, you don't have to play tennis to get tennis elbow, but it could be a cause, and that's usually due to the gripping too hard. Okay, some of the treatment techniques we'll do. We use some anti-inflammatory cream for some massage. I might demonstrate that for about 20 seconds just so you see how relaxing it may be, or painful. So we'll put cream over here. The idea of massage is to loosen up the tension in the muscles so they're not pulling on the bone. And then we just do some gliding massage through there. We might also do some trigger point techniques, so I'll find where it's really tight, like that, and then I'll get Mitchell to extend his wrist up and down. This can be quite painful, but it's really effective. Like that. Okay. Another technique that works really well, thank you. I might get you to stand up, Mitchell. Of course. Is what's called mulligan technique, mobilization with movement. Very interesting technique, but it's extremely effective for tennis elbow. I have patients that score 0 on this, and then I do this technique and they get back their strength immediately, same as the other side. So the way it goes is I get them to squeeze the grip strength, and every time I push, they're going to squeeze. So you want to have a go? I might get you to come around here. Okay, and just face this way. So I go like that, and I get him to squeeze. Go. And usually this will be non-provocative. I'll do 10 reps, and then I'll reassess. So can you squeeze again, as hard as you can? And obviously it's the same, but he doesn't have a problem. Okay, so that works really well. 2 other techniques I would use is some dry needling, which is the Western version of acupuncture. I'll demonstrate a couple for you. Just 2. Again, this works similar to massage. It's going to help release the muscles. And it's not too painful. It's probably less painful than massage. It also helps to down-regulate the nervous system so it's not overactive. Okay, I go until I feel resistance. There we go. We'll do a couple more for the camera. I know you people out there love needles. Okay, I find where it's tightest. Okay, they don't go in too deep, and obviously Mitchell's not in too much pain, so not at all. It's a toughie. Okay, and I like to put one right on where the muscles attach onto the bone at the tendon junction. I might go a little bit deeper on that one. Okay, so that's the needling. We'll take them out now. Okay, no problems there, obviously. Finally, I like to finish off with a bit of kinesio taping. This is really effective. I can do lots of different things depending on what the problem is. My favorite technique is to just apply an X over where the pain is and stretch it down so it takes all the tension off the muscle and absorbs it through the tape. So we'll do that technique for you now. This tape's waterproof and usually lasts about 4 days. And most patients find it very beneficial. Excuse the mess. Okay, Mitchell, can you bend your wrist as much as possible? Okay, relax. Okay, same position. Okay, relax. Okay, and that's that. Finally, I'd advise the patient on activity modifications because it's really important we reduce the load on the tendon so that it can recover. And then we need to strengthen it as well. So my two favorite exercises are isometric strengthening. So we get the patient to push on their hand and try to resist it from going up. And we hold it for 10 seconds. So push as hard as you can, provided there's no pain. And we're going to do 3 sets of 10 of that. That's going to help the tendon to repair and build new tendon cells so that the join onto the bone is much stronger. And then finally, I'll get the patient to do some wrist extension exercises with a ½ kilo dumbbell. 3 sets of 10 roughly, depending on how bad the problem is. And with a bit of luck, and if we get to it early enough, usually you can get better within 3 to 6 weeks. Some cases can be a bit chronic depending on how long the problem has been there for and what the patient does for a living, but generally we always have good results eventually. So thank you for tuning in, and look forward to speaking to you again about the next topic.